Good morning and welcome to the first 2025 episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic through today, January 10th. We invite you to submit any questions or suggested topics down below or via any of our social media linked in the description. Starting with that COVID statistic, average COVID deaths per day in the last reported week were down to 48. In the same week in 2023, we saw 276 daily COVID deaths. Dr. Murphy, your reaction to those numbers?
They haven't really changed. It looks like this is the number that we're just stuck at right now, but it's a lot better than last year. And the reason why it's better than last year is that we have so much more immunity in the population. So many more vaccines been given, so many more people had COVID and survived. That all adds to the combined immunity. So it's just a good sign.
Mm-hmm. And now I know in the wastewater, we've seen some rises in that COVID activity here in the Midwest, more so than the rest of the country. But we're also seeing rises in flu activity around the country. Can you fill us in on that?
Yeah, we're at the peak of the respiratory season. So it's not just one virus. So the virus and Streptococcus, the bacteria, everything is competing with each other. And you have some places it's more COVID, some places it's more flu, but it's all high. That's the point. It just varies a little bit from region to region in the country.
Mm-hmm. Now, our biggest story this week comes from the state of Louisiana, where prior to the holiday break, we reported the first severe human case of H5N1 avian flu. Earlier this week, the CDC confirmed that that patient did pass away. Can you tell us about the case and about avian flu in the country generally?
Yeah, there's at least 66 cases that are known. These are the reported ones. It's hard to get a diagnosis of this, so there's probably many more. But 66 are documented. And of the 66, one patient has passed away, unfortunately. There was an elderly person, 65 years or older, who had underlying medical conditions. This is the classic person who has problems with influenza, whether it's avian flu or just the regular flu. So it's really kind of no surprise there. The reason why avian flu is getting so much attention is that historically, now remember, it's hard to make the diagnosis, or it's challenging. Since 2003, globally, 960 cases have been reported worldwide. And of those reported, 450 died. Now, that means a 50% mortality. That's where this 50% mortality comes from. But we don't really know how many cases there are. And of course, really sick people and people who die tend to get investigated more thoroughly. So it's an overrepresentation of the deaths, but still it's high. But this is why people are so afraid of avian flu, because this mortality rate is like way higher than here. I mean, if you look last year, would we have some 20,000 cases of regular flu? And we have up to 35,000 cases deaths per year. That's all really bad, but we don't know what avian flu is going to do. It really depends on how it changes over time, how it mutates. Because right now, except for 3 people, everyone had been working with cows who get avian flu, but typically don't die, or working with birds who get avian flu, and most of them die. And then the person who passed away in Louisiana had been in contact with birds that were in his backyard. So there was some kind of exposure there. So 3 cases floating around that there was no known animal contact. But, other animals also get avian flu. Cats get it, and they don't do as well with it as dogs. Dogs get it and tend not to pass away from it. But you know, we don't. These are things that we don't know about at this particular point. The fear is, and in the man who died in Louisiana, there were some mutations in there that suggest that yet one or two more minor mutations would make this virus, that virus, much more transmissible. So what that translates to in real English is that could lead to person-to-person transmission. Now, there's other mutations that would perhaps make the disease more severe. So those are the fears, and that's why everybody is worried about it, and that's why there needs to be more work done on avian flu, not only in people, but in the animal world too.
Absolutely. So like you said there was some noted mutation, but it's not the one that's going to make the virus, explode into a pandemic.
Yeah, but that's the one, but it's going in the direction that could happen.
Mhm. And it was just announced that just over $300 million by the HHS was donated or is being allotted to monitoring the avian flu. So that is good news that we are keeping a very close eye.
Yeah, I wouldn't use the word donated. It's federal government money from the Department of Health and Human Services has been directed towards avian flu monitoring and detection. 2/3 of it approximately is going directly to the states and territories. So there's 50 states and 6 territories with people. When we say territories, that means Puerto Rico, the District of Columbia, Guam, North Mariana Islands, and stuff like that, where there are territories of the United States. Anyway, and then 1/3 of it is being used more centrally to develop more tests and whatever. So this is just the beginning of an improved monitoring system, but this is really just a drop in the bucket, what's needed. And because the potential is so real that this could become yet another COVID-like epidemic, it's very important that this gets worked on very closely. And this is a good start.
Absolutely. Good to see some action happening there.
Good start, right.
Now, over the break, there was some really exciting and really great things published about Paxlovid. The first is a full study on patients showing the efficacy of the drug, and the second is a report looking into those with long COVID. Could you start with that general study and let us know what they found?
Yeah, so this is a study published in Clinical Infectious Disease, a very respected American journal. The data have been reported before in press releases with early presentations and whatever. So it's not really new, but what is new is this is the final report. So this has been written and reviewed by experts outside of the author's circle. Then edits were made to the document. And so this is the final report. And so what they show, this is a big study, 21 different patients from 21 different countries, almost 2,000 participants, and it was placebo controlled. So they got Paxlovid or a placebo that looked like Paxlovid. So nobody knew what they were getting. And what they found was those that were treated with the drug were much less likely to get infected. And those that did get infected ended up in the hospital, were in the hospital for shorter periods of time. As far as overall survival goes, people live a lot longer now with COVID, but there were no deaths in the Paxlovid group, and 15 deaths in the placebo group. So this is a survival benefit. So the researchers just say Paxlovid not only reduces the risk of hospitalization and death in symptomatic high risk, these are high risk people with mild to moderate COVID, but consistently demonstrated efficacy in all the other endpoints that were measured. So it just confirms what we had already known.
And it's great to have that final report to point to. It'll be great for pharmacists to be able to point to as well when diagnosing or Yeah, giving that to their patients. Now,
Correct.
the second report is very, very interesting. It was more of an observational look at long COVID and Paxlovid, which previously we haven't seen much efficacy there, but there was some interesting results here. Can you share them?
Not only that, but there have been other reports where it showed there was no benefit for people with long COVID to take more Paxlovid. This is a very small study out of the University of California, San Francisco, published in Communications Medicine just very recently. And their study found slightly different findings. It's not a placebo-controlled study. It's not a large study. Matter of fact, it only involves 13 people with long COVID. And what they found was that 5 of the 13 patients experienced sustained improvements in their symptoms. So that's a very positive finding. But this is just an observation, very critical observation in 13 people. So, and they give a couple examples of how the patients did, but it just means we have a lot more work to do in this particular area, and maybe some people will benefit from longer courses of Paxlovid.
Yes, very, very interesting. And we will keep up to date with any more literature that comes out in that realm. But our final story for today is a bit of a shocking one. From Costco, there has been a recall of 24 packs of eggs due to salmonella. Can you give us the details?
Yeah, this is really unfortunate. So they found salmonella cultured from the eggs, all right? From I guess it's the surface of the eggs. And this resulted in 10,800 packages of 24 count eggs sold under the Kirkland brand signature to be recalled. That's a lot of eggs. And it's mostly in the southeastern part of the United States, by the way. So no people have gotten sick from this that anybody knows about. But the reason why that recall took place is if you look at the whole picture of salmonella in the United States on an annual basis, the CDC estimates that about 1.35 million illnesses occur. So that's a lot, okay? And those 1.35 million illnesses result in 26,500 hospitalizations. That's a lot. And 420 of those people die. So this is a potentially lethal disease. That's why you've got to be very careful with salmonella. It is treatable, but you have to make the diagnosis. The diagnosis in this case is pretty easy by doing the appropriate cultures. So, I mean, Costco did the right thing, recalled those eggs, destroyed them, and so far nobody has reported getting sick from that. But as you can see from these numbers, it would be very easy for some of the people to have it, not know it, and just get better on their own. But regardless, nobody has gotten severely ill from this, and the recall has been done. The FDA actually increased the class of the recall to a class 1 on December 20th. They imply that there's a reasonable probability that the use of exposed to a violative product will cause serious adverse consequences or death. So this just upgraded the recall.
Yes, absolutely. That was big news. I know the initial recall was announced sometime in late November, but now it has just been elevated to this higher class. So very important to keep an eye out for. But on that note, I'd like to thank you, Dr. Murphy, for your time and expertise breaking down all of these stories for us. I know you're very busy right now with all the avian flu news going on. So thank you for your time.
Happy New Year.
Thank you, and Happy New Year to all of you. Thank you for joining for our first episode of this new year. We hope you enjoyed, and we hope to see you back next week. If you have any questions or suggested topics, please leave them down below or at any of our social media linked in the description. We'll see you next week.